dangerous diseases that can kill people over 75 years old in 20 minutes. As the body grows older, it becomes more vulnerable to serious health threats. For people over 75, even a small symptom can sometimes point to a deadly condition. And in some cases, a person's life can change or end within just 20 minutes. This is not meant to cause fear, but awareness. Because knowledge saves lives, and in the hands of the elderly and their loved ones, the right information can mean the difference between life and death. In this video, we'll explore 7 of the most dangerous diseases that can kill people over 75, often suddenly, often silently. We'll explain how each one works, the warning signs to watch for, and the steps you can take to reduce the risk. These are not just statistics, they are real threats, but also real opportunities to act early, act smart, and live longer. So, whether you're a senior yourself, a caregiver, or a concerned family member, this information is for you. Let's take a close look at what really matters after 75. Your health, your safety, and your life. Before we dive deeper, subscribe to Elder Wisdom Table and hit the like button because together, we're building a space for guidance, inspiration, and the strength to age with grace and purpose. Let's get started. Number 1. Sudden cardiac arrest. Sudden cardiac arrest is the #1 killer in elderly adults worldwide. It occurs when the heart's electrical system malfunctions, causing the heart to suddenly stop beating effectively. This disrupts the normal rhythm, stopping blood flow to vital organs, including the brain and lung. Without immediate intervention, death can follow within just 3 to 5 minutes. Unlike a heart attack, which is caused by a blocked artery, sudden cardiac arrest is an electrical problem. The heart just stops pumping. Often there are no warning signs, or one moment the person may appear healthy, and the next they collapse, become unresponsive, stop breathing, and lose their pulse. The risk of sudden cardiac arrest increases significantly with age. For seniors over 75, several factors make the heart more vulnerable, such as a history of coronary artery disease, prior heart attacks, irregular heart rhythms called arrhythmias, or heart failure. Other risk factors include high blood pressure, diabetes, smoking, obesity, and a family history of heart disease. But the most critical point is that sudden cardiac arrest can strike without warning, making prevention and preparedness essential. When cardiac arrest occurs, the window for saving a life is extremely narrow. Every second counts. Without cardiopulmonary resuscitation, or CPR, and the use of a defibrillator, the chances of survival are slim. CPR helps by manually pumping the heart to maintain blood flow to the brain and other organs until advanced help arrives. A defibrillator, also called an AED, or automated external defibrillator, delivers an electric shock that can restore the heart's normal rhythm. In many cases, early CPR and defibrillation can double or triple the chances of survival. Unfortunately, many elderly victims die because no one nearby knows how to respond quickly. That is why it is crucial for families and caregivers of seniors to learn CPR. Knowing where the nearest AED is located in the home or public places can save precious minutes. Symptoms that may warn of sudden cardiac arrest are often subtle or absent. However, some people experience dizziness, chest pain, shortness of breath, or palpitations before collapsing. If you notice these symptoms in a senior, seek medical attention immediately. Regular heart checkups are also important to detect and manage risk factors. Medications such as beta blockers or antiarrhythmic drugs may be prescribed to reduce risk. Lifestyle changes play a key role in prevention. Maintain a healthy diet, exercise regularly within your ability, avoid smoking, and manage conditions like diabetes and hypertension. If a loved one has a history of serious heart issues, doctors may recommend implantable devices like a pacemaker or an implantable cardioverter defibrillator, ICD. These devices monitor heart rhythm and can deliver shocks automatically if dangerous rhythms occur. In summary, sudden cardiac arrest is a silent and deadly threat to seniors. Preparedness through education, training, and quick access to CPR and defibrillation can save lives. Remember, if someone collapses suddenly and is unresponsive, call emergency services immediately and start CPR without delay. Every second lost decreases the chance of survival. Stay informed, stay prepared, and help protect the hearts of those you love. Number 2. Stroke. Stroke is one of the leading causes of death and disability among people over 75 worldwide. It occurs when blood flow to a part of the brain is interrupted, causing brain cells to die within minutes. This sudden loss of blood supply can be due to a blocked artery, called an ischemic stroke, or a ruptured blood vessel, called a hemorrhagic stroke. The brain controls every function in the body: movement, speech, sensation, memory, and balance. When a stroke strikes, these functions can be affected immediately and severely, sometimes leading to permanent disability or death. Older adults are at the highest risk of stroke due to age-related changes in blood vessels, increased incidence of high blood pressure, diabetes, heart disease, and other conditions. The risk doubles every decade after age 55, making seniors especially vulnerable. Recognizing the early warning signs of stroke can save lives and reduce long-term damage. The most common symptoms appear suddenly and include weakness or numbness, especially on one side of the body, sudden confusion or trouble speaking or understanding speech, trouble seeing in one or both eyes, difficulty walking, dizziness, loss of balance or coordination, severe headache with no known cause. A simple way to remember stroke signs is the acronym FAST. FAST refers: F, for face, drooping one side of the face may droop or feel numb. A, refers for arm weakness, one arm may drift downward when raised. S, for speech difficulty, speech may be slurred or strange. T, for time, if any of these signs are observed, call emergency services immediately. Time is critical in stroke treatment. Brain cells die by the minute when blood flow is blocked. The sooner treatment begins, the better the chance of recovery. Treatment for ischemic stroke often involves medications to dissolve the clot or surgery to remove it. In hemorrhagic stroke, controlling bleeding and reducing pressure on the brain are vital. After the acute phase, rehabilitation plays a key role in recovery. Physical, occupational, and speech therapies help regain lost functions and improve quality of life. Prevention is the best strategy to reduce stroke risk. Manage high blood pressure, cholesterol, and diabetes carefully. Maintain a healthy lifestyle, eat a balanced diet, stay active, avoid smoking, and limit alcohol. Regular checkups with your doctor are important to monitor and control risk factors. For some high-risk patients, blood thinners may be prescribed to prevent clots. Seniors and caregivers should know that if stroke symptoms appear, urgent medical care is essential. Delays can cause irreversible brain damage and greatly reduce survival odds. In summary, stroke is a medical emergency that demands quick recognition and response. By learning the signs, acting fast, and managing health proactively, seniors can protect themselves against this devastating disease. Number 3. Pneumonia. Pneumonia is a serious lung infection that poses a major threat to seniors, especially those over 75. It occurs when bacteria, viruses, or fungi infect the lungs, causing inflammation and fluid buildup in the air sacs. This impairs breathing and reduces oxygen supply to the bloodstream and organs. Older adults are particularly vulnerable to pneumonia due to weakened immune systems and other chronic health conditions such as COPD, heart disease, or diabetes. In fact, pneumonia is one of the leading causes of hospitalization and death among the elderly worldwide. The symptoms of pneumonia can vary widely, but often include persistent cough, sometimes producing phlegm or mucus, fever and chills, shortness of breath or rapid breathing, chest pain that worsens with coughing or deep breaths, fatigue and weakness, confusion or delirium, especially in seniors. Because symptoms can be subtle or mistaken for other illnesses, early detection can be challenging, but is critical for effective treatment. Pneumonia can develop quickly, and if left untreated, it can lead to severe complications such as respiratory failure, sepsis, or lung abscess. The infection can overwhelm an older person's already fragile health, making timely medical attention essential. Treatment depends on the cause of pneumonia, but often includes antibiotics for bacterial infections, antiviral medications for viral pneumonia, and supportive care such as oxygen therapy and fluids. Hospitalization may be necessary for severe cases, particularly if oxygen levels drop or breathing becomes difficult. Prevention is key, especially for seniors. Vaccinations against pneumococcal bacteria and influenza viruses can greatly reduce the risk of pneumonia. Good hygiene, hand washing, and avoiding close contact with sick individuals also help prevent infection. For those with chronic respiratory conditions, regular medical checkups and managing underlying illnesses are vital. In addition, maintaining a healthy lifestyle by eating well, staying active within your limits, and avoiding smoking can strengthen the lungs and immune system. Caregivers should be alert to any changes in a senior's breathing or behavior and seek prompt medical advice if pneumonia is suspected. In summary, pneumonia is a dangerous and potentially fatal disease in the elderly, but with early detection, vaccination, and proper treatment, many lives can be saved. Stay vigilant, protect your lungs, and don't delay seeking help if you or a loved one shows symptoms. Because for seniors, every breath counts. Before we dive deeper to the next, subscribe to Elder Wisdom Table and hit the like button because together we're building a space for guidance, inspiration, and the strength to age with grace and purpose. Number 4. Chronic obstructive pulmonary disease, COPD. Chronic obstructive pulmonary disease, or COPD, is a progressive lung disease that affects millions of seniors worldwide, especially those over 75. It includes chronic bronchitis and emphysema, conditions that cause long-term airflow blockage and breathing difficulties. COPD develops slowly over many years, often due to prolonged exposure to irritants such as cigarette smoke, air pollution, or occupational chemicals. In older adults, COPD significantly reduces quality of life and increases the risk of life-threatening complications. The main symptoms include persistent cough with mucus production, a shortness of breath, especially during physical activity, wheezing and chest tightness, frequent respiratory infections, fatigue and reduced ability to exercise. As the disease progresses, even simple activities like walking or dressing can become exhausting. COPD also weakens the lung's ability to fight infections, making pneumonia and other respiratory illnesses more dangerous. For seniors, COPD is a major cause of hospitalization and death. In advanced stages, the disease can lead to respiratory failure or heart problems known as cor pulmonale. Although COPD is incurable, proper management can slow its progression and improve symptoms. Treatment includes quitting smoking immediately if applicable and avoiding lung irritants. Medications such as bronchodilators and steroids help open airways and reduce inflammation. Pulmonary rehabilitation programs provide exercise training, education, and support to help patients manage their condition better. Oxygen therapy may be necessary in advanced cases to maintain adequate blood oxygen levels. Vaccinations against influenza and pneumonia are critical for COPD patients to prevent complications. Early diagnosis and ongoing medical care can help seniors maintain independence and reduce hospital visits. Family members and caregivers should encourage adherence to treatment plans and watch for worsening symptoms like increased shortness of breath, chest pain, or confusion. In summary, COPD is a serious, progressive disease that requires vigilant management, especially for seniors. With the right treatment and lifestyle changes, many elderly people can live longer, healthier lives despite this condition. Stay proactive, breathe carefully, and seek medical support early to control COPD's impact. Number 5. Alzheimer's disease. Alzheimer's disease is the most common form of dementia affecting millions of seniors worldwide, especially those over 75. It is a progressive brain disorder that slowly destroys memory, thinking skills, and the ability to carry out simple tasks. Alzheimer's begins with mild memory loss, but eventually leads to severe cognitive decline and loss of independence. The disease affects the brain cells, causing them to shrink and die, which disrupts communication between nerve cells. The exact cause of Alzheimer's is not fully understood, but age is the strongest risk factor. Other factors include genetics, family history, cardiovascular health, and lifestyle. Early symptoms often include forgetting recent events or conversations, difficulty finding words or names, trouble planning or solving problems, getting lost in familiar places, changes in mood and personality. As the disease progresses, these symptoms worsen. Seniors may forget close family members, struggle with daily activities, and lose the ability to communicate. They often need full-time care to ensure safety and well-being. There is currently no cure for Alzheimer's disease, but treatments can help manage symptoms and improve quality of life. Medications may slow cognitive decline and help with behavioral symptoms. Non-drug approaches such as cognitive therapy, social engagement, and structured routines are also important. Support for caregivers is essential because caring for someone with Alzheimer's can be physically and emotionally demanding. Research suggests that maintaining heart health, staying mentally and physically active, eating a balanced diet, and managing chronic diseases can reduce the risk or delay the onset of Alzheimer's. Early diagnosis allows families to plan care, access resources, and support the senior's independence for as long as possible. In summary, Alzheimer's disease is a devastating illness that profoundly affects seniors and their families. Awareness, early detection, and compassionate care are key to managing this disease. Number 6. Diabetes complications. Diabetes is a chronic condition that affects how the body processes blood sugar or glucose. While manageable, diabetes becomes increasingly dangerous with age, especially for seniors over 75. The biggest concern isn't just the disease itself, but the severe complications it can cause when poorly controlled. For older adults, long-term diabetes can quietly damage nearly every organ system in the body. It increases the risk of stroke, heart disease, kidney failure, vision loss, nerve damage, and life-threatening infections. The two main types are Type 1 diabetes, usually diagnosed in youth, and Type 2 diabetes, which is far more common in older adults. In seniors, Type 2 diabetes can often go undetected for years, especially if symptoms are mild or mistaken for aging. Some warning signs include frequent urination, excessive thirst or hunger, unexplained weight loss or fatigue, blurred vision, slow healing wounds or frequent infections. Over time, high blood sugar silently damages blood vessels and nerves. This can lead to heart attacks or sudden cardiac arrest, kidney failure requiring dialysis, diabetic retinopathy causing vision loss or blindness, peripheral neuropathy leading to pain, numbness, and infections, especially in the feet, and in severe cases, amputation. Infections in diabetics can spread quickly and become life-threatening. Even minor wounds can become ulcers that won't heal. Pneumonia, urinary tract infections, and sepsis are more common and far more dangerous in seniors with diabetes. Managing diabetes in older adults requires extra care and regular monitoring. This includes keeping blood sugar levels stable, maintaining healthy blood pressure and cholesterol, eating a balanced, low-sugar, high-fiber diet, staying active within one's physical limits, avoiding tobacco and excessive alcohol. Medication regimens may include insulin or oral drugs, but seniors must take care to avoid low blood sugar or hypoglycemia, which can cause dizziness, fainting, or falls. Caregivers should be trained to recognize these signs and respond quickly. Annual screenings for eyes, kidneys, feet, and cardiovascular health are essential to detect complications early. In addition, mental health support is crucial as diabetes is linked to depression and cognitive decline in seniors. Preventing complications means staying consistent with treatment and acting early when problems arise. In summary, diabetes may seem manageable, but when ignored, its complications can kill quietly and quickly. Through regular care, healthy living, and support from loved ones, seniors can live long, full lives with diabetes. Number 7. Sepsis. Sepsis is one of the most deadly and under-recognized medical emergencies in seniors over 75. It occurs when the body's response to an infection becomes extreme, triggering widespread inflammation and organ failure. If not treated quickly, sepsis can kill within minutes to hours. In older adults, the immune system is weaker and slower to respond. This means even minor infections like a urinary tract infection, a small wound, or a mild case of pneumonia can spiral into sepsis. Sepsis doesn't always look dramatic at first, but the danger escalates fast. Watch for early signs: sudden confusion or disorientation, rapid heartbeat, fever, or sometimes a low body temperature, shortness of breath, chills or shivering, clammy or pale skin, extreme pain or discomfort, low blood pressure or fainting. In seniors, the first sign may simply be confusion, sleepiness, or a sudden decline in function. Caregivers often mistake it for fatigue or a medication issue, but that delay can be deadly. Once sepsis sets in, it can lead to septic shock, kidney, liver, or heart failure, limb amputation due to tissue death, and ultimately, death sometimes within just 20 minutes. In severe cases, hospitalization is immediate and aggressive. Treatment includes intravenous antibiotics, fluids, oxygen, and medications to maintain blood pressure. Time is everything. Every hour without treatment increases the risk of death. Prevention starts with controlling infections early. Seniors should be regularly checked for signs of infection, especially in the lungs, urinary tract, skin, and mouth. Vaccinations such as the flu shot, pneumonia vaccine, and COVID-19 boosters are powerful tools in preventing the kinds of infections that trigger sepsis. Caregivers and family members must act quickly at the first sign of infection. If a senior suddenly acts off, confused, feverish, unusually tired, seek medical care immediately. Never wait and see. When it comes to sepsis, minutes matter. In summary, sepsis is a swift and silent killer that often hides behind ordinary infections. But with early recognition and immediate treatment, lives can be saved. Stay alert, know the signs, and take every infection seriously, because for seniors, even a small fever can turn into a life-threatening emergency. You've now learned about 7 of the most dangerous diseases that threaten the lives of seniors over 75. Sudden cardiac arrest, stroke, pneumonia, COPD, Alzheimer's, diabetes complications, sepsis. Each one is serious, but not one of them is unbeatable. The most powerful defense we have is early action. In all 7 of these conditions, what matters most is not just treatment, it's timing. Every minute counts. So here's what you can do starting today to stay safe, stay informed, and stay alive. Pay attention to subtle changes. Confusion, fatigue, a lingering cough, or chest tightness may seem minor, but in seniors, these could be the first signs of a medical emergency. Don't ignore them. Don't wait. Get checked. Get regular screenings. Blood pressure, blood sugar, cholesterol, heart rhythm, cognitive function, these should all be monitored regularly. Don't skip your annual exams. They're your safety net. Stay up to date on vaccinations. Pneumonia, flu, shingles, all of these can trigger fatal complications. A simple vaccine can save your life. Ask your doctor what's right for your age and condition. Manage chronic illnesses strictly. If you have diabetes, COPD, or high blood pressure, stick to your treatment plan. Take medications on time. Monitor levels. One missed dose or unchecked number can cause a deadly spiral. Know the emergency signs. Learn to recognize stroke symptoms: facial drooping, arm weakness, slurred speech. Know what sepsis looks like: confusion, fever, rapid heartbeat. And make sure someone in your home knows CPR and where to find an AED. Build a circle of support. You don't have to do it alone. Have family, friends, or caregivers check in regularly. Let someone else notice if something about you seems off. This kind of daily observation can catch a crisis before it escalates. Strengthen your body daily. Even light exercise, stretching, or walking boosts circulation, lung function, and brain activity. Eat a colorful, balanced diet. Drink water. Get enough sleep. You're giving your body the tools to fight back. Prepare for emergencies. Have a list of your medications and medical conditions easily accessible. Keep emergency contacts on speed dial. If you live alone, consider a medical alert device that can call for help. And most importantly, listen to your body. At 75 and beyond, your body speaks in whispers, not shouts. Don't wait for a scream. Respond to the whisper. Because prevention is not just about adding years to your life, it's about adding life to your years. More laughter, more calm mornings, and more moments with those you love. So stay alert, stay informed, and stay connected. Your life is still full of meaning, strength, and value. Don't let silence or delay steal it away. If you found this video helpful, like the video and don't forget to subscribe to Elder Wisdom Table and click the bell icon so you never miss a tip designed to help you live well after 60. Share this video to you loved ones. Let me see what you learned from this episode in the comment, and share your story or experience someone may learn from your tip. And also, reading your valuable comment inspired and motivated us to create more insightful contents. Get inspired, stay informed, and most of all, keep living wisely. Thank you for watching. See you in the next video.